coordinators help patients navigate the healthcare system to get the things they need.
I help patients find medications that might be more affordable for them, or if we can't find any of those options, might help them apply for programs such as patient assistance programs through the pharmaceutical companies. Work with them to help them navigate the healthcare system.
Physicians report that care coordinators make patient visits go more smoothly by taking care of important tasks that otherwise would cut into their already brief time with the patient.
I was skeptical at first. I thought this was going to be a huge amount of increased work for me. I thought it was going to be increased time. It's been really totally the opposite. The care coordinators can help to visit plan for certain things so that I know on ahead what's going on with the patient, and I can be more on top of things when I go in to see the patients. And also just they think of things that I haven't thought of that are instrumental in the patient's care, and that helps to just take care of a whole realm of things. Things like helping them to find out where they get transportation, how to get home care services that maybe I didn't appreciate that they needed, that were a barrier to their care.
A study called Diamond found that patients with chronic conditions such as depression get better care when they work with a care coordinator.
Diamond actually comes out of research at the University of Washington, where a psychiatrist did studies showing that patients get much better care and get dramatic improvement in results by being managed by a care team. And he pointed out that depression patients typically fall through the cracks when they don't get better with the first medication, and there's only about 30% likelihood, then they tend to blame themselves and they don't come back. So by virtue of having a nurse coordinator monitor the patient, and then also bringing in a psychiatrist for knowledge base, we've actually doubled the improvement in depression patient.
One of the unexpected pieces of it for me has been how it's helped me take care of populations of patients. I had anticipated that there would be real benefit in dealing with individual patients, but my diabetes numbers have gotten a lot better with somebody that the patients respond to, talking to them over time to make sure that they're keeping track of the numbers that I would want to keep track of but couldn't do as easily. That for me has allowed me to make more efficient use of the individual visits. When the patients come in, they know more about the issues that I want to talk about than they would have before, and it's helped them improve their diabetes, and my entire population is better for it, I think.
Patients are identified for participation in the healthcare home and referred to a care coordinator.
What we've done is we've actually empowered all of the team members to initiate a referral. So if there's any team members that on the team at the clinic that feel the family would qualify or would benefit from healthcare home or care coordination, we ask that they tell us, and we notify, we get them involved in the program. The formal referral process is the primary care provider would then refer them to me, and I would meet with the family, hopefully while they're there at the clinic. It's really nice to establish that face-to-face the first time we can meet. And if we can't meet, then I will follow up with a phone call or however the family prefers that we connect.
Care coordination needs vary by patient and may include making appointments and referrals to valuable community resources.
It helped my son and my family and myself to make the appointments and referral to the right place like Alexander Center and Eddie Prairie, because I don't know where or calling who if we don't have that help. To fill out the applications for the state insurance. Is in communication with the school.
We have the primary care here, so if I have a patient that comes in and they have a lot of maybe complex issues going on and they're referred outside of our clinic to a specialist within the health system. We are the home base that we pull that all together for them by helping them make sure they get the appointment, make sure they're able to get to the appointment and understand what happened at that visit and what the next step is.
Some patients are given a care plan with all their medical information so they don't have to remember or repeat it when seeing a new provider.
One example would be for my knee surgery that I had recently. I went to the surgeon and she started asking me lots of questions. And finally I said, wait a minute. And I reached over and I pulled out my care plan and showed it to her and she went, wow, this is great, this is great. And as she was reading down, she was looking at, oh, you had this condition. Oh, that's important. I would have never have told her about it. I had some internal GI bleeding. What does that have to do with knee surgery? I would have never mentioned that to her. But it was very significant and important to her. And after she finished reading through my care plans, she had no more questions for me. She had all the information she needed.
Timely interventions as a result of care coordination help prevent disease exacerbations that may lead to an emergency department visit or hospitalization.
We were able to have the child seen when they had a flare and actually have gotten the condition completely under control. So a child who was followed by 12 specialists is now followed by myself and one specialist and is going to school and looks great. The family is doing well now. They're not so stressed. I'm not so stressed.
That same day we had a much more complex patient that had, through the aging process and some new medical problems, been in the hospital. She had a complex family system issue. She needed a lot more services and there was a complicated dynamic to work through, and we huddled the care coordinator and the health support nurse and I huddled before she came in. My visit with her was actually quite brief. It was about a 15-minute follow-up visit from the hospital, but I think they spent about an hour and a half with the patient and her family trying to figure out what services were available and how we could bring in a process of change so that she'd be able to stay in her home.
Care coordination helps physicians feel more supported when treating patients with complex medical conditions. So we interviewed physicians and non-physicians at a healthcare home site and asked them questions about how their workflow changed, how their practice was different, and what it was like to work in this sort of different team approach. And our findings were universally positive. Physicians repeatedly told us that they feel less alone in caring for these somewhat at times overwhelming and medically complex patients. And the support staff were very engaged in keeping these medically complex patients out of the hospital and improving their quality of life.